Good afternoon, everyone. Good afternoon, everyone. For poll participation, we have a way poll participation. There are some instructions regarding the poll and quizzes via Slido app. Here is a demonstration of Slido app where you have to click on the panels to open automatically during poll in WebEx app, and poll appear on the right side of the screen. If it doesn't appear, there is an option one in which we have to close the participant tab, and in option two, there is an app called Go to Slido. There you will see the question. So regarding the Slido, please go to the bottom right of your screen and select the app icon. From there, choose Slido and you will find the poll for this session. It will become active as soon as the question is raised. आप लोगों से एक निवेदन है, सेशन शुरू होने से पहले हमारे हर सेशन के बाद एक पोल का हमारा एक क्वेश्चन एंड आंसर राउंड सेशन होता है जिसमें आपके एमसीक्यूज की तरह होते हैं। उसके रिगार्डिंग आपको सेशन शुरू होने से पहले आपके लिए इंस्ट्रक्शंस के लिए हमने यहाँ पर एक प्रेजेंटेशन आपको तैयार किया है। उसमें आपको एक स्लाइडो ऐप करके एक ऐप आपके राइट हैंड साइड पे एक आपको पोल अपेयर होगा जहां पर आप लोगों को ये 3 तरह के उसके नोटिफाई होंगे। जहां से कोई अगर लैपटॉप से ज्वाइन कर रहे हैं तो आपके अपने राइट स्क्रीन से, जैसे कि ऑप्शन 1 एक में दिखाए गए ऑप्शन से आपको कर सकते हैं। अगर कोई पार्टिसिपेंट मोबाइल से ज्वाइन कर रहे हैं तो आपको पार्टिसिपेंट का जो टैब है वो क्लोज करके वहां से दिखेंगे। ऑप्शन 3 ये है कि अगर किसी को वो भी शो नहीं हो रहा है तो आपकी जो भी वेबएक्स के एप्स करके एक ऑप्शन आएंगे उस पे आपने ऐप क्लिक पे ऐप करके ज्वाइन करेंगे। चौथा ऑप्शन ये है कि आपकी राइट साइड पे तीसरा जो 3 डॉट वाले एक ऑप्शन आइकन दिखाएंगे तो वहां पर जाके आप अपना स्लाइडो चेक कर सकते हैं। With due permission, we will be starting our webinar session. And good afternoon, namaskar, everyone, and very warm welcome to all distinguished dignitaries, esteemed speakers, and participants joining us today for this webinar series on the PHEDM Connect Bridging Knowledge and Action. And today's webinar theme is Organizational Model for Managing Response, jointly organized by the National Institute of Disaster Management, Ministry of Home Affairs, the National Center for Disease Control, Ministry of Health and Family Welfare, and the US Center for Disease Control and Prevention, India. We are privileged to have with us eminent expert who will share valuable insight into the incident response system in India and its principles and features, which play a very vital role in strengthening our disaster and public health emergency management capabilities. It is my privilege to introduce Dr. Sanket Kulkarni, Joint Director, NCDC, Ministry of Health and Family Welfare. He will deliver opening remarks for today's session. Over to you, sir.
Thank you, Dr. Sanjan. Hope I am audible.
Yes, sir, you are audible.
Okay. Good afternoon, everyone. Good afternoon, Surya Prakash sir, Dr. Yogesh, Runa ma'am, Dr. Sujit sir. Good afternoon, all the guests who have joined here and participants. It gives me an immense pleasure actually to welcome you all on this fourth webinar of the monthly series of Public Health Emergency and Disaster Management Connect workshop for bridging knowledge and action. This initiative has been jointly organized by National Center for Disease Control, Ministry of Health and Family Welfare, National Institute of Disaster Management, Ministry of Home Affairs, and CDC, Country Office India, which aims to strengthen our collective capacity in public health emergency and disaster management. Actually, this time we have crossed almost more than 700 registrations. This is actually record registration that happened in the webinar series, sir. So this is one of the good registration, and I hope this gives an this reflects the growing interest and commitment of our professionals across the country to build resilient systems for managing public health emergencies. Today's theme is organizational model for managing response. Comes at a very crucial juncture because it is an effective organizational models from the which forms the backbone of the emergency response system, and ensuring that resources are mobilized efficiently, roles are clearly defined and coordinated in a seamless way across agencies and sectors. Lessons from recent emergencies, both global and national, highlight that well-structured response mechanisms not only save lives, but also reduce the long-term impact on the communities. On behalf of NCDC, I extend my gratitude to all our partners at NIDM, CDC, and all the eminent speakers today from DM Cell, Dr. Yogesh, who will be sharing their insights today. I encourage each one of you to engage actively in the discussion. You can ask questions so that you are clear about the concept of this organizational model. And as your perspective and experience are invaluable in shaping the resilient systems for this in your state and the district for the future. With these words, I once again welcome you all and look forward for an enriching session ahead. Thank you.
Thank you, sir, for your valuable context. Now, I would like to request Professor Surya Prakash to address our participants for today's webinar session, sir. Over to you, sir.
Thank you, Stanjin, and welcome to all the dignitaries, including Dr. Sanket, Dr. Sujit Singh ji, then Runa Gokhale ji, and we are also joined by Professor Muzaffar Ahmed, the former member of National Disaster Management Authority, and Dr. Yogesh, our expert of today's webinar, and also all the participants who have joined on this webinar. sparing their valuable time to learn from each other. This is actually a very important occasion because we have started initially during the COVID period, the integration of public health emergencies with disaster management. And since then, almost now it's going to be 5 years, we have been continuously trying to take it forward, not only through face-to-face programs, but also through the online programs, be it the trainings, workshops, or seminars or webinars. And also at times we had conducted national conference too. But recently, after a lot of programs, we found that some of our interested professionals, they are not able to attend or participate in these programs. And we thought of having a series again, which we started during the COVID-19 on PHEDM Connect. That is getting how this integration and convergence and mainstream would be possible. And then talking about the different aspects and dimensions of that. So that's how we have taken it forward. And each time we are focusing on a specific theme. For example, this time, as Dr. Sanket has mentioned, we have focused on response efficiencies and management. So if a stitch in time saves 9, that means if we are acting timely, a lot of casualties can be reduced, which is one of the first targets under our Sendai framework for disaster risk reduction. And we can also reduce the number of population affected. So these are some of our objectives, and hopefully we'll share. I will not speak more because we have the presence of very high dignitaries. Maybe I would request Professor Muzaffar Ahmad to throw some light because of his presence. He can actually tell, because he has seen them from the top and he has worked in the field. So I think there cannot be any better dignitary on this platform than him, who can actually tell us our directions and way forward and the vision and the mission and to proceed. So I would request, rather than I speak on this occasion, looking at the presence of Professor Muzaffar Ahmad to say a few words and show us the pathway, sir. Sir, please.
Oh, thank you.
And thank all.
Thank you, Professor Surya Prakash. I must first compliment all the organizers, NIDM, NCDC, CDC, and the Dr. Singh and others who have made it possible to have this webinar on an important subject, that is management of response. And you have rightly said, we have been seeing the number of disasters, and if a response is good, we will be able to save large number of people from the death and provide the necessary help and support. Although, you know, there have been various organizational models starting from California, incident command system, incident management system, and in NDM, sometime during 2008-9, it was the concept of IRS, which is suited to our country, was framed. And these guidelines, IRS guidelines, which were issued by NDMA, has been very well accepted and has been practiced in many districts all over the command, all over the country. And the management, it gives completely the management functions of whether it's an incident command, planning, all which will be discussed in the due course. And it will be a rather a standard organizational model that has to be applied to all the emergencies and hazards, and especially when we have seen the Uttarakhand, cloudburst in Jammu and Kashmir, where we lost number of lives. So I'm sure the capacity building by way of webinar is going to be helpful to various stakeholders and states, and I'm quite sure today's webinar will be helpful. And I would only suggest that this IRS has to be practiced in wherever at the district level or at the block level by way of simulations or the mock drills. Thank you very much.
Thank you, sir.
Thank you, sir.
Viewers, for sharing valuable
Please
insight
go
with
ahead.
our participants. Now, I would like to request all the panelists to switch on their videos for the good photographs. Sir.
Dr. Stanzin, I would welcome actually Dr. Rajat is also here. He's also joined, and yes, we welcome him
Runa is
also.
also there. Maybe
Yes,
we
Dr.
can
Runa
add
is also here.
all. Dr. Sujit ji is also there. Let's hear few words, and then we can have a joint photograph.
Yes, sir.
So
Sure, sir.
Actually, I missed Muzaffar Ahmad sir. Sir, sorry, sir. Actually, we before I got into this, we could not see the video. That's why.
I would request Dr. Sujit sir also to say a few words before we actually begin the presentations. And Dr. Runa, if she is there, she.
Thank you, Dr. Surya sir, and a very good afternoon to all the dignitaries who have joined virtually and also visible on video also. So I take this opportunity just to welcome all the participants or the PHEDM capacitated persons who are there in the districts, because they need to refresh their knowledge and they need to share their knowledge also with us. Whatever experiences, what they have undergone during the field after the completion of the trainings. So I think that will help us in improving our own qualities as well. And we will be also using their experiences in future webinars so that there is a mutual learning between all of us. So I think I'll stop here and I look forward to the wonderful presentation which follows. Thank you very much.
Thank you, sir. Dr. Runa, Dr. Rajat from CDC may like to. Dr. Rajat?
Good afternoon, sir.
Please.
Good afternoon, everyone.
Yeah.
It is a pleasure for me to join this webinar, which is jointly organized by NCDC, NIDM, and CDC. And we have such esteemed panelists, the presence of panelists, eminent speakers. And I'll just like to echo your point that this webinar series is envisaged because of one of the reasons was the request of the participants who actually wanted continued learning. Just to complement the Tier 3 training program in which we train district level officers from the disaster, health, as well as animal husbandry. So this has been their request to the organizations to conduct such webinar series. That is why it is being conducted. And thank you everyone for joining this webinar. Over from my side, sir.
Thank you, Dr. Rajat. I would request all the dignitaries to kindly switch on their video so that our organizing team can have a group photograph. And then we can begin with the technical sessions.
My apologies, Professor Surya Prakash, that I was having difficulties joining audio.
Dr. Runa,
just want to add my thanks.
Now your turn to say some words, please.
No, absolutely. Thank you for having me here. Just want to give my thanks and congratulations to Professor Surya Prakash and Dr. Sanket for your institution's visionary establishment of this webinar series. I think it has served a lot of good already to those who have benefited from the PHEDM trainings and will continue to serve so much good for the larger public health emergency and disaster management community. So my thanks and congratulations to all of you for the hard work that you have put into organizing these webinars and to the panelists who have given their time to present their expertise today. I'm very much looking forward to the learning that will happen today.
So nice. So request all dignitaries to kindly switch on your videos so that our team can have a group photograph of all the and enjoy the presence, auspicious presence of everyone. Dr. Sanket,
Sir.
Sujit sir, and Dr. Yogesh, Professor Muzaffar Ahmad sir. Stanjin, you also switch on and yeah. Switch on your videos.
Yes, sir. Done, sir. We have taken the screenshot. Thank you, sir.
Yeah.
Thank you.
Before we move into the technical session, we would like to begin with a short participation poll regarding the PHEDM Tier 3 participation, and kindly take a moment to respond it. Now, I would like to request all the participants for a poll participation. For this participation, please go to the bottom right of your screen and select the apps icon. From there, choose Slido and you will find the poll for this session. It will be active as soon as possible when the question is raised. Now, we have a Slido on your right side of the screen. Kindly click on this panel. You have shown one question. It is kind of MCQ, in which question goes like, how did you join today's webinar? Option 1 is mobile phone. Option 2 is laptop, computer. Third is tablet, or D is other. To kindly respond according to whether you have joined through mobile phone, laptop, tablet, or other. Thank you, everyone. For next question, we have next question. Are you attending the session individually or part as a group? Option 1 is, have you all seen the Slido? Option 1 is individual and option 2 as a part of a group. I want to thank you all the participants for your active participation in poll. Now we will move towards the technical session. Before we begin the technical session, I would like to share a few general instructions for all the participants participating in the webinar session. After each participation, there is a poll related to the topic. After all the presentation, we have question and answer session. For this, I would like to request you to raise your questions or queries in the chat box. Now we will start our technical session. For our first technical session, which is on principles and features of the IRS, it is now my pleasure to introduce our keynote speaker for today's session. I am delighted to welcome Dr. Yogesh Kumar, Chief Medical Officer, Disaster Management Cell, Ministry of Health and Family Welfare. He will provide us with an in-depth understanding of the IRS framework and its operational aspects, highlighting how it can be adapted in public health emergency management. Over to you, sir. Yogesh, sir.
Thank you, Stanzin. I hope I am audible.
Yes, sir, you are audible.
So before I start with my presentation, I didn't know that I'll be getting a chance to meet the stalwarts like Professor Muzaffar Ahmed, Sujit sir, and Surya Prakash sir. And thank you so much to Runa ma'am and Dr. Sanket also, along with NIDM, to organize this wonderful webinar and giving me an opportunity to share my views and inputs on the topic. And I'll start sharing the presentation from my side then.
Okay, sir.
I hope it's visible to all. Hello?
Yes, sir. Yes, sir.
Okay. So before we delve into the topic of IRS, let me start by saying that as a medico, since the management aspects is something that is taught very little during your curriculum as a graduate or a postgraduate. So IRS sometimes comes across as a totally alien subject, especially to the medicos, unless you are you have been a part of administration for a long time, or you have professionally undertaken this course, or you are part of some service where such management and such flow of command is an inbuilt part of the system, like in law enforcement and other similar services. This concept of IRS may appear a little alien to a regular medicos, because the things that we usually deal as a medico, like surveillance or clinical cases or number of tests done, so this, rather than those activities, it's broad. The concept of IRS is basically a management approach, and how this management approach can be utilized to better address our preparedness and response capacities against disasters and other public health emergencies. So before I get to this slide, so incident response system, it's a combination of facilities, equipment, personnel, procedure, communications that operate within a common organizational structure with responsibility for the management of assigned resources to effectively accomplish stated objectives pertaining to an incident. So it's not a new approach, as Muzaffar sir was hinting at. It's a system that has been adopted from the California fire fighting system from 1970s. It was basically a collaborative effort of local, state, and federal or national fire agencies, how they can collaborate and coordinate their efforts to manage wildfires effectively. But seeing the pros of the system, the management system, it has now been widely adopted globally by disaster relief organizations and public health agencies. So what the system provides is a standard, uniform, flexible, collaborative approach for command and control and coordination of disaster management throughout its cycle, from preparedness till response and rehabilitation and recovery. It incorporates all tasks that may be performed irrespective of their level of complexity of disaster. So you could invoke disaster from a small incident to a large scale or a nationwide calamity. It ensures there is efficient, clear communication among all agencies by owing to there being a common structure and common use of terminologies. It requires identification and designation of officers from various agencies, because disaster response is a multi-sectoral response, and it requires a coordination between different agencies. So they should be able to talk to each other, coordinate with each other in a language that is that is easily understandable to all the stakeholders that are involved, and it gives a avenue for a flexible team approach, where you can modify the structure of the IRS from a very small structure to a very large nationwide structure, or even beyond that. So it minimizes an ad hoc response through a structured approach. It builds multifunctional teams to manage all response needs, because even the smallest task involve close collaboration between different types of personnel with different academic and academic background or service backgrounds. Then it assigns and trains officers for clear roles and responsibilities. It emphasizes on documentation and standardization in any sort of communication, so that everybody is accountable, and there is a inbuilt learning possibility that is created by properly documenting everything that went in disaster preparedness and response activities, and thereby it reduces chaos and confusion. So the basic features of the incident response system are common terminology. So as a medico, when we enter the college, the only uh, terminology that we understand is medical terminology, and the only hierarchy we understand is is a first year student or a second year student, then a PG, then a postgraduate, then junior consultant, senior consultant, that kind of terminology. But once you get out of that system and work in a real world scenario, then you see that there are multiple expertise that are collaborating on field, which have come from different academic backgrounds. So they may not be using those exact terminologies which you are you are very much at ease to use, and they may have different hierarchical levels depending on the designations. For example, there may be a medical officer or a chief medical officer, there may be a joint director, deputy director, there may be an undersecretary, a joint secretary. So that creates a lot of confusion and it hampers coordination, that who will report to whom. The second part is establishment and transfer of command. So the IRS system basically calls that there should be a single person who is called the incident commander, and who basically directs how the structure will evolve, what will be its objective, what strategies it will follow. And this command is basically the senior most official that is present at the site of incident when the incident occurs. And as the scope of the disaster or the incident changes, or if there is availability of somebody from a senior level or a much more expert level, then that person can assume the charge of the incident commander. That is called the transfer of command. In some scenarios, there may be a change in the type of incident. For example, a fire accident at a chemical factory may lead to a chemical explosion, and that would require the restructuring of the entire IRS system. There is unity of command in the sense that every individual has a designated reporting officer and a chain of command wherein there is clear-cut reporting pattern. Unlike the system that many of us may be very accustomed to, wherein you may be called by many superiors, or you may be reporting to many superiors, but the IRS system provides that you are only responsible to report to one person, and there are people who will report only to you in the field or in whatever situation the IRS structure is evoked. There is unification of command in the sense that at every individual there is a team, every individual contributes to a team effort so that they can effectively manage the incident at a particular locality, or in giving a particular type of service like triage or referral services or first aid, those kind of things. The area command is basically the the exercise of overseeing multiple incidents or complex cascading incidents in specific geographic area that may exceed the capacity of any single incident response team to respond to. So there may be multiple sites of disasters. There could be multiple landslides. So that would require that multiple teams from the operations multiple teams are conducting operations, rescue, relief, and first aid and referral, those kind of operations at multiple sites. So that is a kind of area command, but those individual teams are basically part of a bigger overall structure. In terms of planning and organizational structure, the management is by objective. That is you understand what are the applicable rules and regulations, that who should be the lead agency, who should play a supportive role. For example, if there is a radionuclear emergency, then then the Department of Atomic Energy should play the lead, but there is definitely a role of other sectors like health to play a supportive role. We need to decide on the objectives, then select the appropriate strategy and assign the right kind of resources so that there is no wastefulness and there is no lack of or dearth of essential resources at the site of response. The operation period basically is a time frame for executing specific actions within a disaster response period. For example, it may refer to the search and rescue phase only following a building collapse. So an operational period may comprise of maybe a duration of maybe 3 hours, 4 hours, 5 hours, and the only objective during that period is to complete the search and rescue part. And this operation period basically feeds into or is a part of a larger incident action plan, which is a plan with objectives reflecting the total overall strategy as well as the goals which we must comply to and implement at the field so as to achieve the desired objective. One of the unique thing about the IRS structure is that it's a modular organization. If you remember that if you have smaller pieces which are similar and you can connect them and form something bigger. So the IRS system basically works pretty much like that. And depending on the scale of the event, you can add multiple similar teams or similar units or similar machineries or similar resources so that each team along with those resources and equipment is working coherently with other teams depending on the scale of the event. So it could be a small event like a building collapse or a landslide, or it could be something spanning a much wider or larger geographic area like an earthquake. The IRS approach also calls for a manageable span of control. So ideally, one person should be ideally one person should get reported from 3 to 5 units. So if the number of units that are reporting to a particular individual is exceeding 5, perhaps there is time for now to split that team into 2, or if there is a reduction in number of teams to less than 3, so perhaps we can merge 2 units to create a single team. So that is what we mean by manageable span of control. In terms of facilities and resources, there should be comprehensive resource management in the terms that there should be a detailed and systematic management of resources with focus on efficient identification, procurement, allocation, and tracking of all resources that may include personnel, equipment, facilities, so that there is no wastefulness and we are able to effectively respond to disaster or an emergency. Sorry. So in terms of incident location and facilities, these are temporary setups that are established at or very close to the site of the incidents. It can be an incident command post where the incident commander is stationed. It could be a staging area for resource development. It could be a base for logistic management. It could be a camp for relief purposes. And in terms of communication or information management, there should be an integrated communication which works on networks and tools to ensure that there is seamless communication and there is provision for redundancy. There should be a common alerting protocol like Code Red. You must have heard about Code Red that is used during hospital fires. The idea is to alert everybody who knows what Code Red stands for, while simultaneously not to create panic among the other residents of the health facilities. And there should be information management in the sense there should be seamless and as close to near real time flow of information within different sections, as we are going to learn in the following slides, that the operation sections, the planning section and logistics section, each should be aware of what each other's requirement is and how they are consuming resources, what could be their possible future requirements, what things they have accomplished so far. So there should be a proper information management system. By adhering to these principles, we basically find that the IRS system stands for accountability. There should be delegation, and there should be proper dispatch and deployment of resources and equipment. So the overall structure of the IRS, it can be basically divided into the command structure, which includes the incident commander and the command support staff, and the three broad arms or sections, which are operation sections, which directs the tactical actions. Then the planning section, which undertakes information gathering, preparation of incident action plan, documentation, and the logistics section, which provides for equipment, support services, those kind of things. And within that logistics system is the finance system, which basically tracks the costs of personnel, contracts, equipment, and it may be placed under the logistic under the IRS system, but it forms a separate section of its own in the original ICS system. So you may look at this picture, and the top half, the incident commander, the information media officer, the safety officer, and the liaison officer, along with the deputy incident commander. This is basically the apex or the head of the incident response system. And below are the sections, and each section is divided into branches. And depending on their geographical location, for example, in the operation section, it could be divided into different divisions. Different divisions could be divided into different groups or task force or strike teams. Similarly, the planning section can also be subdivided into the resource unit, basically keeping a track of what are the resources which are coming to the site or are going out of the site, what is the current situation in terms of people affected or the utilization rate of the various equipment consumables, then documentation of every incident action plan or the operation period, and the demobilization unit, which basically signals when it is the time for the disaster response mechanism to demobilize. And the logistics section can basically also be, because it's a supportive function, it can also be divided into service branches looking into communication, medical, food unit. But here the medical unit and the food unit is basically catering to the first responders and not directly to the victims. The support branch, which consists of resource provisioning unit, facilities unit, ground support unit, which is basically responsible for creation of incident command post, staging areas, those kind of things, and the finance branch, which is basically keeping a track of where the resources, the finances are required and how much it is required. And if there is any compensation involved, then how much compensation needs to be given. So this, I believe, is, I have already covered it. So we can now go on the major functions of different functionaries, like the incident commander. The incident commander is the lead of the on-ground operations in disaster preparedness and response settings, and his objective is to provide, the overall objective is provide the guidance to the response strategy, as well as to ensure that it is executed or implemented optimally at the ground level. He or she is the one who determines or finalizes the incident objective, strategies, and the incident action plan. The incident commander establishes immediate priorities. It approves and authorizes the implementation of incident action plan, coordination of activities between between the command structure and the general staff, and final approval of resources, and the keeping higher authorities informed about what is going in the field is also the function of the incident commander, because he is basically the connecting link between the higher authorities and what is happening on the ground. And he is the authority which authorizes the release of information or orders demobilization of resources when it is appropriate to do so. The second is the public information officer, which basically advises the incident manager on the information dissemination and media relations, obtains information across different sections of the IRS, and develops communication products. He also interacts with a variety of audiences and media so as to correctly and accurately report what is happening on the ground and during disaster response specifically. A safety or a security officer is basically the one which is monitoring and making sure of health, welfare, and safety of all the responders. He gives guidance on the safety aspects as well as psychological and emotional challenges that staff may face during the response, and also advises the incident managers on issues regarding safety. The liaison officer is primarily responsible for information exchange between internal and external stakeholders as well as partners. These partners may be government partners, private partners, or international partners. And he or she basically assists the incident manager by serving as a point of contact for representatives from other agencies or ministries. So a liaison officer should be able to take call or decisions in matters of coordination with other agencies. So what are the core functions of the three major sections? The operations section enables response activities like utilization of resources, management and coordination of activities in a PHEOC setting or in a disaster scenario on-site setting, or it is a hospital, then in a hospital setting, provides technical expertise in terms of how to treat patients, especially when we talk about medical response and those kind of things. He or she also informs and coordinates and enables daily response activities. So this is basically the working branch of the overall IRS structure. Next, we come to the plan section, which is basically responsible for the analysis, planning, training, and evaluation function. They develop and manage the training and exercise program during the periods of non-activation. Then they develop plan for mobilization, demobilization. They maintain and update response plan. And they are basically, this is the section which is basically responsible for any sort of documentation. The logistic function basically provides for resources and services. It may include ordering, obtaining, tracking, maintaining, and accounting for essential personnel, equipment, and supplies that may be required for preparedness or response to any disaster or any incident. They maintain incident facilities like camps, warehouses, those kind of things. They provide or arrange transportation services for the operations team if they require. So they process check-in and tracking of resources, and finally demobilization of resources. The finance and administrative part of the logistic branch is responsible for expenditure tracking, payments, and administrative services. They keep a timekeeping of how much, because if incident involves hiring of some resources from a private provider, then the proper documentation must be there for how much period that equipment was used during the response period. So deviating a little bit from the topic of IRS, because there is the IRS is basically feeding into the disaster response management. The disaster response, as you know, it's a tiered structure in India, especially after the enactment of DM Act 2005, and basically calls for planning and execution and coordination across national, state, and district levels. The incident response teams are established at all levels and can be activated by responsible officer. Responsible officer could be a chief secretary or a district magistrate, and this responsible officer is supported by incident commanders, which are appointed on ad hoc basis to manage on-ground operations. So this is the basic institutional framework at national level. At national level, there is national disaster management. At national level, the top level decision-making committee, which is chaired by the cabinet secretaries, NCMC, which is assisted by Cabinet Committee on Security, and they get requests from state, and the National Disaster Management Plan basically directs which agency or central ministry or department should lead the preparedness and response activities in those regards. At a state level, there is a similar state executive committee. There is constitution of SDRFs similar to what NDRF we have at the national level. There could be a state emergency operations center under SDMAs, and these work with these disaster-centric agencies. They basically also work with different line departments at the state level. This part I think I have already covered, but here I would like to mention that the National Disaster Management Plan 2019 and the National Policy on Disaster Management already outline which are the different agencies who should take a lead in different hazard scenarios. For example, Ministry of Health and Family Welfare is identified as the nodal lead authority for biological emergencies like disease outbreaks, but it has to play its supportive role whenever there is public health impact due to other kinds of hazards. This part I think we can skip. We have already covered it. So IRS as a system and its linkage with EOC, as well as India Disaster Resource Network, DM plan, and emergency support function plans. So as you are aware that Emergency Operations Center is a central hub for emergency activation coordination. It maintains a resource database and can direct distribution of resources as well as personnel to respond to any kind of disaster. The disaster management plan is an overall plan which basically outlines the roles and responsibilities of different stakeholders. The emergency support function plan is an auxiliary plan, which is basically trying to ensure that there is continued delivery of essential services. And the India Disaster Resource Network, it's basically an online inventory of response equipment and trained human resources, which is managed at district level for quick mobilization. So the EOC staff can utilize this online inventory. And if anybody of you has not still visited this website, it's a very useful website. You can actually go and see what kind of resources are available in your particular district in terms of equipment, medical services, or hospital services. So like the disaster management structure, the EOCs can also operate at 3 different levels: national, state, district, and sub-district levels. And these EOCs can belong to different departments. For example, Health Emergency Operations Center is stationed in the health departments. Similarly, there could be similar EOCs under law enforcement, disaster management component, and other agencies that are involved in early warning signs or response to disasters. This part I think we can skip, and these are few of the examples where the ICS or the IRS system was activated. It was seen in US Hurricane Katrina, during the swine flu in 2009, during the Mpox outbreak. but a similar kind of approach, although not strictly which may be termed as IRS or ICS, has always been adopted by various response agencies, by Government of India also in previous, especially in the aftermath of DM Act, when there is clear delineation of roles and responsibilities between different departments, and within that department organizations, and within that those organizations different divisions. So there is a whole of government approach that basically feeds into the IRS system whenever it is required. So key takeaways is that we need to institutionalize IRS across all level of government to ensure there is structured and coordinated preparedness and response. So especially in the health sector, there is a very less uptake of this IRS approach. And this, by adopting this approach, we will promote an interagency coordination and clarity of roles and practice the principles of unity of command that allows for flexibility as well as scalability. And we encourage documentation and learning from past incidents if we adhere to or try to comply to the IRS approach. Thank you.
I sincerely thank you, sir, for delivering insightful lectures on the principles and the features of the incident response system. And these sessions clearly highlight the basic features, management functions, and the role of the incident commanders and commandant staff, while emphasizing the importance of planning, logistics, and accountability in the disaster response. And the practical example, including Harina, Katrina, and the H1N1 pandemic, made the concept more relatable and demonstrated the effectiveness of IRS in the real life scenario. We are truly grateful for the valuable knowledge and the guidance shared, which is greatly strengthened our understanding and capacity in public health emergency and disaster management. So thank you.
Thank you.
We now invite our participants to participate a quick poll to capture your feedback from this session. For this for poll participation, please go to the bottom right of your screen and select the apps icon. To choose Slido, there you will find the poll for this session, and it will be activated as soon as the question being raised. The question is being: the Emergency Operations Center provides critical support to the incident response system by ensuring coordination, information flow, and resource management. True or false? For now, we have received 23 response from our participants. Thank you everyone for your active participation. And now we move to our second technical session. It is now a pleasure to introduce our keynote speaker for today's session, Professor Surya Prakash, Head GMRD, CBRN and Industrial Cyber DRR, NIDM, Ministry of Home Affairs, Government of India. He has been a guiding force in the domain of disaster risk reduction and capacity development across India. And his lecture will set the context for today's theme by outlining the structure and the application of the IRS in our country. So over to you, sir.
Thank you, Stenjin. And good afternoon to all. My work has been made easier by the presentation from Dr. Yogi, who had just shared the idea of what incident response system is and how we are using from the perspective of a health specialist, a doctor, how he has conceived the idea and it's being implemented in the field of disaster management, particularly in case of biological disasters. And he also mentioned about some of the hydrometeorological disaster, particularly the cyclones. No, I will just try to share a few more ideas from the perspective of a disaster management professional who has been working in this area for about last, say, 3.5 decades. Stanjan, my PPT is visible?
Yes, sir, you're visible, sir.
In slideshow mode? It's not.
The slide is not moving,
Is
sir.
it moving? Yes.
Yes, sir. Now yes,
It is moving, no?
Yes, sir.
Right. So, friends, disasters, they have become more frequent visitors to our lives because now number of disasters, they strike us at different times and places. You may be still recalling what happened in Dhrali and how people got buried underneath a thick heap of debris. And those who survived also were affected and required health services. And immediate response was one of the prerequisites to save lives. But then there are situations where the accessibility, remoteness, and the difficulties of operation actually delays the safety operations and also the search and rescue activities. So what disaster management has been envisaged under the Act is that we should plan, organize, coordinate, and implement different measures which are required for saving lives, be it in a pre-disaster situation in terms of our prevention, protection, mitigation measures, or be it in terms of response activities, immediate response and relief measures or rehabilitation actions, or in terms of post-disaster activities, which we go for reconstruction, relocation, and recovery or redevelopment operations. So now this particular theme of incident response system is very much important, particularly in the disaster situations. And if an appropriate coordination is not done, because there are too many actors to play, so therefore, if they are not in harmony with each other and don't listen and act together like an orchestra, no, when they have a different musicians and a singer and others, if they're not playing well, then the harmony will be lost. So therefore, we will not enjoy that. And there, in these cases also, we have emergency support functions, wherein we require people who can carry out operations and also people who can support those operations in terms of resource and logistics that are required to carry out those operations. So be it physical, be it financial, or be it technical requirements, everything needs to be working together. So I'm just showing you a case how we have been trying to deal with these kind of disaster situations where health emergencies arise, and then there is a lot of crowd and chaos that happens at the hospitals and at the disaster sites. So if these people are not controlled and adequate command and coordination is not done, then we will be having a lot of problems in these areas. So just let me go ahead with the other parts of the presentation. I'll just bring this down. As told by my colleague, Dr. Yogesh, that incident response system actually came out from the fire department, USFS, who used to face a lot of big challenges in terms of huge number of wildfires that were striking the US. And then they had to manage it using some system which can actually control, which they named it as incident command system, where the command coordination and collaborations were done in a very systematic manner with pool of resources, where roles and responsibilities of each stakeholder was well defined. So this was taken up as a systematic, proactive approach, guiding all concerned departments and agencies at every level, be it private, be it government, or be it non-governmental organizations, to work flawlessly in an emergency and disaster situation. So that was the main purpose of devising this particular method and approach. The mission required coordination amongst different organizations. Now, what happens most oftenly, these people have not interacted or familiarized with each other, and they are often at the same levels. So there is often a tendency for insubordination. So if this system is not in place, the command from one person who is the incident commander on and responsible officer will not be followed by other people who are working at the same levels in other departments. So therefore, it was thought of that how several different agencies and departments and officials who come together to act upon a given situation can actually collaborate and coordinate and go in a very systematic command and coordination mechanism order. So India, while looking for such best practices way back in 2005 to 10, studied many of such practices which were being followed in different countries. And we came out with a example of the incident command system, which had 4 different sections initially. And we tried to modify it according to our conditions and renamed it as response system. There were other names also which were prevalent, particularly in health sector, which was termed as incident management system 2. But broadly, all these systems, whether it is ICS, IMS, or IRS, they had the similar structure and mechanisms to follow for disaster response. One is that this had an advantage that there was single command line. So the roles and responsibilities were well defined, because this did not create any confusions or conflicts among the roles and responsibilities in those situations. So they were all well defined and made very clear about those resources, roles, and responsibilities. Then this system actually was devised right to cater to the needs of a small incident at local levels to a larger incident at national and even international levels, which you have witnessed during the COVID-19 too. And small incidents like landslides and floods, which have been happening in our country. So this is the kind of scalability that is possible right from the grassroots levels to the national and international levels. Then there is often a confusion, as Dr. Yogesh also pointed out, that they have a specific terminology which they are conversant with during their education and during their profession. But at the time of coming together with other stakeholders, they have to learn other terms as well, so that everybody understands the same thing by the same word and applies in the same manner. So therefore, a standard terminology for communication has been devised through this incident response system, and also the resources management. Now, resources are lying, as also pointed about Dr. Yogesh, with different organizations. So now we have to bring them together, mobilize them together and acquire them. So we need to know where they're lying and who is the responsible officer for that. For these purposes, NIDM actually started with the India Disaster Resources Network. You can see a portal, idrn.nidm.gov.in. And this resources inventory helps us to locate those resources and acquire those resources as quickly as possible. Then our memories are very short because we forget as soon as the incident is over. So documentation is one of the most important activities so that we can always recall the lessons that we have learned from the past cases of disasters. So documentation has also made an essential under the incident response system. Further, in order to bring better and effective coordination, we involve all agencies. There is an interagency coordination which is required under the incident response system. So these are all things that are part of the incident response system. Now, the Disaster Management Act 2005 actually envisaged establishment of disaster management authorities at all levels, that is at national level, National Disaster Management Authority, at state level, State Disaster Management Authority, then the District Disaster Management Authority, and there now after the amendment during this March, the Urban Disaster Management Authority. Now these authorities have well-defined constitution and compositions as well as the mandates defined under the Act. The NDMA is responsible for policy, guidelines, and plans at the national level, and it issued guidelines for the incident response system way back in July 2010. This was well clarified that in order to manage our disaster incidents, the states need to adopt and implement the incident response system. The incident response system actually required the incident response teams in the field. So in this direction, as per DM Act, the designations of different officials who would be made responsible for a particular action at particular level, they have also been defined. And responsible officer is often the Chief Secretary of the state, who is the most empowered executive. And in the districts, it's the district magistrate. And similarly, at the local levels, it's the municipal officer at the level of municipal corporations in the urban areas. Look into this structure. As I said, responsible officer, if you are talking about the state, because disaster management is a state subject, is often the Chief Secretary. Incident commander in the state would be the Secretary Revenue and Disaster Management, and then he will be supported by the section chiefs at operation level, planning level, and the logistics levels. And each of these chiefs will have their branch leaders, and this branch will have different group leaders. So this is how the command systems goes in incident response system. So overall, this structure, this has already been discussed, so I'll not repeat. Except for the air operations, there is a separate officer. Rest all are well integrated into that system, which is followed in incident response. Besides the section chiefs, there are three other important officials who are there to support the incident commander. Incident and media officer, who is often from the information services, and then they have a liaising officer for coordination with different departments, and a safety officer to look into safety and security related issues at the local level. And often the incident commander is also supported by a deputy incident commander, who is often an additional district magistrate level person. Now, in order to activate, whenever information goes to the emergency operation center, it is sent to the responsible officer. Now, responsible officer will activate the incident response system, and incident response system once activated, will give directions to the respective incident commanders to initiate actions. So the first thing would be to get the briefing about that incident, how big it is, where it is, and what are the impacts, and what are the actions taken, what actions are desirable, what are the resources available, where are the gaps in those resources. All that will be put up in the form of incident response form 001, where briefing is well coordinated in a structured manner, so that all the information is acquired, and then discussions are held with other section chiefs, and thereafter an incident command post is established near to the site of the disaster area. Then thereafter, the logistics section starts the resource mobilization, coordination with line departments, and also acquire all other resources which are desirable. Whereas the planning section starts the planning works in terms of the kind and the type of the incident, and supports the operation sections in carrying out their activities. Operation sections will have one which is response, other is transportation branch, to acquire and place those resources at an appropriate staging area. Now, role of different stakeholders is also well defined, and the lead agencies on the ground, because there are first thing, if you have to have a staging area, the acquisition of a ground where you can place those resources which are required for response purposes. So the district administration, it will provide the ground response and logistics. Then the response forces who are to carry out the response actions, it can be National Disaster Response Force, or it may be personnel from our State Disaster Response Force, or at the district level, sometimes quick response teams. They have also been formed, so they can be there. So either QRT or SDRF or NDRF, they will go for search and rescue operations of when the incident strikes, and also seek the technical support from the technical professionals in order to carry out those response activities. Then the other local departments who can provide security and other resources include the police, fire services, health department, and public works department. These are often considered as support functions. There are around 14 such emergency support functions which are required to play their important role in terms of resources required in the disaster situations. Besides these emergency support function departments, we have NGOs, we have CBOs, community-based organizations, we have other voluntary organizations like Red Cross and civil society bodies, which also provide and extend support in terms of relief, shelter, and logistics. Further, the decentralization process has also ensured the role of PRIs and ULBs. So therefore, they can also extend the support in terms of outreach for early dissemination and last mile connectivity. So these are some of these actions which are collectively required from different stakeholders. And for the purpose of implementation, the state SDMs, they are expected to notify this. I'm just showing you one of the notifications which was done way back in 2014 by the State Disaster Management Authority from Government of Assam, that they are implementing. And you can see for each of these IRS, they have defined a particular responsible officer or the duties as designated. For example, for responsible officer, they said Chief Secretary to the Government of Assam. Then for the incident commander, it would be the senior most secretary in terms of revenue disaster management. And then for air operations, it will be the transport department, because transport department can look into air, road, rail, or sea or water routes, which can be easily taken care by that kind of nodal officer. And for the information and media officer, it is the public relations officer. Then liaising is often done by the DGP or by the chief executive officer, and DGP is the safety officer. Then planning section chief and logistics, each duties are well defined. I will not go more detail because there is shortage of time and we had a time bound webinar. But let me give you that this kind of adoption of the incident response system within the country by the State Disaster Management Authority has actually helped us a lot. Previously, wherever we had to have exhibitions, fairs, festivals, or get-togethers, there were a lot of stampedes and also the difficulties in crowd management. And now with the implementation of incident response system in the states, the very big melas like the Kumbh Mela, Mahakumbh during 2025 in Prayagraj, it could be managed without much casualties, and we could do implementation of incident response system in that. And this has been well taken care and proven to be very effective in terms of management of incidents whenever, wherever they happen. So this was one of the examples. Then we have many other examples. I recall June 2023, we had a major cyclone, a Biparjoy cyclone in the state of Gujarat. Then in Ludhiana, we had in April 2023, we had the gas leakage. And then Amarnath Yatra 2022, we had an incident of a flash flood. Then Morbi Bridge collapse in Gujarat, and COVID-19, all of you are well aware, from 2020 to 2022. And also the forest fires in Uttarakhand and Kerala floods during 2018. All are such examples where the incident response system was implemented and proven to be very effective in terms of the command control coordination system under this particular mechanism. Then its integration with the EOCs. EOCs nowadays, now Digital India also started with some mobile applications where even the actions, first the reporting from the crowdsourcing and also the state of actions till the emergencies or crises are overcome are well monitored using those applications. And then use of data from the Indian disaster resources network, and also the digital tools like the dashboards during COVID-19 you may have seen, and use of the web geographic information systems based web platforms for decision making and analysis and looking into the trends were found to be very useful. Then in order to enhance its effectiveness and widespread use, NDMA guidelines way back in July 2010, and NIDM actually published training modules. Around 10 relevant such training modules have been prepared by NIDM, which is one of the nodal institutions for training on IRS, and also conducted those trainings for senior officials, command staff, as well as the other levels of officials, and capacity development of responsible officers, incident commanders, section chiefs, and the general staff was also planned. This is not enough to do just the trainings. We have also done hands-on exercise and practical mock exercises and mock drills, as well as some of the simulation exercises at state and district levels. I would, because of shortage of time, we are not able to go in depth. So therefore, I would suggest the audience to kindly go to the NDMA website, ndma.gov.in, where you can go to the guidelines and download this July 2010 guideline on incident response system, which has been by NDMA under Section 6 of the Disaster Management Act as part of their responsibilities. Then there are other information. For example, the Assam State Disaster Management Authority also published a handbook, which is also available on the link which has been provided by us in this presentation. That is CHAR, CHAR.assam.gov.in, from where you can find the IRS handbook too. And all these modules which pertain to the training for logistics section chief, for the operations section chief, incident commander, integrated planning section chief, the basic and intermediate incident response systems training, safety officers training, liaison officer training, area command training, and advanced IRS, along with integrated planning section course training modules. They are all available at NIDM.gov.in. You can go to the publication section and can download these modules from this website. So friends, here now I would conclude that incident response system does promote coordination, command, and control with efficiency and timely decisions. Regular trainings and refresher courses, they are very much required because we are joined with new officials and also the officials who have been working. They are engaged with many other different activities. They also need to refresh their knowledge and also carry out some mock drills exercises as well. Integration with emerging technology is very much required nowadays. The applications of GIS, ML, drones, etc. has become prevalent, and therefore we need to integrate these resources. In terms of resources, we have different type of teams that are built into the incident response system. One are the strike teams, which use a specific type and kind of resources, and there are also the task forces, which are having a dedicated task using different type of resources. But there are single resources teams as well, where the specific type of resources are used by those particular stakeholders. Then community participation is inevitable and is very much desirable, and also the local level governance in terms of incident response system through Panchayati Raj institutions and urban local bodies is highly desirable. So with these words, I thank you for this opportunity and hope we can work together as a team and also support each other as part of incident response system. So thank you very much. Here and we can have any questions, Stanjin, if there are.
Yes, sir, we have a question and answer
Yeah,
session
please.
after the poll, sir. After the poll.
Please.
I sincerely thank the Professor Surya Prakash for his insightful presentation on the incident response system in India, and your presentation clearly explained the IRS framework, organization structure, and the stakeholder roles, while practical example like Assam model and the Mahakumbh Mela 2025, but the concepts very relatable, and we are very grateful for your valuable insight, which will strengthen our understanding and practice of disaster management. Thank you, sir. Dear participants, to take a quick poll to gather your reflection on the first session, please share your response to help us to evaluate and improve our further future sessions. For poll participation, please go to the bottom right of your screen and select the app icon. From there, choose Slido and you will find the poll for this session. It will become active as soon as the question is being raised. The question is, when is the incident response system required to be activated? Option 1 is only during routine administrative activities. Second is only for international emergencies. Third is whenever a disaster emergency situation arises that requires coordinated response. And fourth one is for annual government audits. Till now, we have received only 24 responses. Kindly share your responses for further. which gives a lot of further feedback for our future session. Thank you each and everyone for your active participation in the poll. Now we come to the question and answer session. I would like to request participants to raise your questions or queries in the chat box. We encourage you to share your queries or reflection from your local context, as well as this is a space for the shared learning. We have one question for Dr. Yogesh from Dr. Asad, and question stating that what is ad hoc response?
Only the college will give the checklist.
Thank you, Stanton. So an ad hoc response is to a reaction or is an action taken in an unplanned, improvised, situation-specific manner during an emergency or a disaster. Unlike a structured response system like what the IRS proposes, ad hoc responses are usually spontaneous knee-jerk reactions without predefined roles, procedures, and coordination mechanism, thereby increasing the likelihood of ineffective response or suboptimal response and wastefulness of resources.
Thank you, sir. Thank you, sir, for answering the questions. I hope Dr. Asad will receive the information regarding the ad hoc response. And one question for Surya, sir, from Dr. R.V. Brar. At the local medical level, what activities are recommended to keep the local personnel, especially doctors, prepare for responding to an incident?
It's actually as part of health requirements because doctors have to be prepared in terms of surge capacities, which are required in crisis and disaster situations. So they may be required to coordinate with the other hospitals and professionals in terms of the bed capacities in those hospitals, and also the other sports staff may be required to take care of health facilities. And at times of disaster situations, at many a time the incident is too far, we are also required to manage health facilities close to the disaster sites too. So the mobile health facilities and infrastructure at site at times may be required. So depending on the geographical area and the potential type of incidents, we have to look into this situation. So normally we always recommend first a risk assessment must be done and identify the potential hazards and their impacts. These may be because of geography, or developmental imperatives, or maybe because of climate change and other actions, anthropogenic activities or technological disasters. So depending on those type of disasters, for example, there are industrial areas and fire incidents happen, then there will be more burn cases. So burn wards may be required and number of the larger number of beds may be suddenly required, and how will manage if the number of cases arise or increase beyond our coping capacities. So disasters are always those situations where our coping capacities are exceeded and we need additional resources or additional manpower, infrastructure, and take care of them. At times, there are other situations too. For example, it's not directly the disaster-related cases, but the routine cases during a disaster situation. For example, I can recall when the Biparjoy cyclone happened, there are many deliveries to be taken care, and power supply actually could not be maintained when the cyclone had struck. So alternate power supplies were also managed to carry on the ICUs, the blood banks and other facilities in health infrastructure, and also maintain those ambulances which were required for those patients which were critical in nature or where the deliveries were required to be taken up during that particular hours or time. So the disaster situation demands are like that. For the health sector particularly, I'm telling. Now, Ministry of Health has also thought of having public health emergency operation centers. So specific health related or biological disaster related issues may be taken up by those PHECs, through which they can coordinate then with the disaster management centers and then can receive all type of help. So I hope my answer.
Yes, sir. Thank you so much for
Right.
answering the question of Dr. R.V. Bharati. I hope he will be he will be
Or he needs any more
giving more
clarifications, we can.
clarifications. Yes. Now, thank you all for your active participation, and due to time constraints, we are unable to answer every questions live. We have selected a few questions for our speaker to address. For more information, please check the chat box and our panelists are answering your queries there. Now, I would like to request Dr. Sanket sir for the concluding remarks for the today's webinar session, sir. Over to you, sir.
Thank you, Stanzin. Thank you very much. First of all, I would like to thank the esteemed panelist, Professor Surya Prakash sir, for such a nice presentation. I would like to request the participants also what sir had mentioned regarding the development of IRS or structured IRS, especially using those forms IRS 1, 001, etc. You can get them and try to fill them so that you are well versed with those activities and those terminologies. And in case of need, that will be very, very helpful. So those are some of the points. And I would also thank Dr. Yogesh for such a nice presentation regarding the IRS and the structure, the command, unity of command, etc. So as he has mentioned and he had answered regarding the ad hoc, what is ad hoc response and a structured response. So one should be very, very careful, and so how that system can be very well used in a structured manner without wasting much resources. That is very important. So thank you regarding this. And I would also thank Professor Muzaffar Ahmad sir and Sujit sir, I think so he left, for their comments in the earlier, in the initial part. And Dr. Runa Gokhale from CDC, Dr. Rajat Garg for coordinating all these efforts and requesting and circulating the states for all those questionnaires and other things. I would thank everyone for all these efforts made. Thank you. Thank you all. Thank you, Stanley.
Thank you so much, sir, for your kind information. And now I would like to request all the participants, before leaving the webinar session, we have pinned the feedback link in the chat box. Kindly share your response to help us evaluate and improve our future session. As we draw this enriching session to a close, I would like to acknowledge the support of Shri Safiya Sandersvi, IPS Executive Director, NIDM, Professor Dr. Ranjan Das, Director, NCDC, Country Director, CDC-India, Professor Surya Prakash, Head JMRD, CBR and Industrial and Cyber DRR, NIDM, Dr. Himanshu Chauhan, Joint Director, NHOD, IDSP, NCDC, Dr. Runa Gokhale, Associate Director for Science and Program, CDC-India, and Mr. Williams Abrams, Deputy Director, DGHP, CDC-India. I would like to extend heartfelt thanks to our esteemed speaker, Professor Surya Prakash and Dr. Yogesh, for their experts' insight and real perspective. And I also thank our collaborative partners at NCDC, CDC India, and my colleagues at NIDM for their guidance and support in conceptualizing this monthly learning initiative. And I would like also to extend my heartfelt thanks to the organizing team, Dr. Rajat sir, Dr. Sujit sir, Ms. Pallavi, Ms. Karishma, Mr. Anil, and all those who have worked tirelessly behind the scenes. And special thanks to all participants for joining and engaging with us in this knowledge sharing platform under the PHEDM Connect Bridging Knowledge and Action webinar series. And the next webinar in this series is scheduled for 19th of September 2025 on the topic risk communication and community engagement. We look forward to active your participation in the upcoming session. Until then, stay safe and continue strengthening your role in public health emergencies and disaster management. Thank you and have a wonderful evening. Thank you and Jai Hind. I request all the participants to kindly share your feedback from the feedback form, please. Thank you, everyone. Thank you, everyone, for your active participation. Thank you so much.